Hi, you guys. Welcome back for our daily practice questions. It is day 58, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 45-year-old patient with type 2 diabetes reports frequent morning hyperglycemia despite adhering to their usual evening insulin regimen. After reviewing the blood glucose logs, you notice that their blood glucose levels are consistently lower late at night and then they spike in the morning. What is the most appropriate treatment adjustment for this patient? Is it A, increase the evening insulin dose to counteract the morning hyperglycemia? Is it B, decrease the evening insulin dose to prevent nighttime hypoglycemia? Is it C, administer a late night snack to prevent nocturnal hypoglycemia, or D, switch to insulin therapy that mimics the basal insulin production more closely? Take a moment and tell me what you got, y'all, in the comments. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most appropriate treatment adjustment for this patient? All right, so we're talking treatments and it says adjustment, so they have to have told you what we're dealing with if we're adjusting something, right? So here we are talking type 2 diabetes, but let's see what's going on. We have a type 2 diabetic who is in and they're having morning hyperglycemia despite using their usual evening insulin regimen. We've reviewed the blood glucose logs and we notice that the blood glucose levels are consistently lower at night and then they spike in the morning. So, what does this sound like, y'all? This is Somogyi effect, right? Where we have the nighttime hypoglycemia that causes that morning hyperglycemia. So, knowing this, you want to see the best interest, see administer a late night snack to prevent that nocturnal hypoglycemia, right? Because we want to give them something else so they're not having the hypoglycemia at night because that is what is causing the morning hyperglycemia. With Somogyi effect, that hypoglycemia at night causes a rebound effect that leads to the morning hyperglycemia. So treat the nocturnal issue. All right, question number two. A 60-year-old patient with type 2 diabetes presents with morning hyperglycemia. The blood glucose levels are consistently high upon waking, but they do not dip low at night. You suspect the dawn phenomenon. What would be the most effective strategy to address this? Is it A, increase the insulin dose at bedtime? B, adjust the timing of the evening insulin to a later time to counteract early morning hyperglycemia? C, add a second oral hypoglycemic agent in the morning? Or D, increase the patient's evening carbs to prevent overnight hyperglycemia. Take a moment to tell me what you got. Tell me what you got, y'all. All right, so stem of the question here, what would be the most effective strategy to address this? So what are we addressing, right? And when they're asking for an effective strategy, think plan, think treatment, right? So we need to figure out if they have provided us with a diagnosis. Same strategy I always tell y'all. If we're looking for a treatment, we got to run it back and see if they provided us with a diagnosis. If they have not, you got to run it back a step further and look at the assessment findings so that you're able to determine a diagnosis so you know how to treat that, right? So in this scenario, they're saying the most effective strategy is still the same thing. Don't let wordplay confuse you or make you think through your process any differently, right? So, all right, diagnosis is type 2 diabetes. We're thinking dawn phenomenon, and this patient is consistently having these high morning hyperglycemia. There's no low dips at night, so definitely sounding like dawn phenomenon. So what will we do? Will we increase the insulin dose at bedtime? No. There's nothing showing us that we need to increase it at bedtime. B, is your best answer. You want to adjust the timing of the evening dose. You might need to move it back a little bit so it gives a longer coverage throughout the night and into that early morning, and then see how you're doing. Always try to adjust in the most, if they give you that option, to adjust it instead of changing or doing so much drastic changes until they show you that, hey, bring that patient back in, see if that works before we're starting to make drastic adjustments, right? So B is your best answer. And then question number 3, a 50-year-old patient with type 2 diabetes has been experiencing episodes of hypoglycemia in the middle of the night, followed by high blood glucose levels upon waking. After reviewing their treatment plan, you suspect the patient may be experiencing the Somogyi effect. Which of the following changes in treatment is most likely to improve their condition? Is it A, decrease the total daily dose of insulin? B, change the insulin regimen to a once daily long acting insulin in the morning? C, provide a bedtime snack to help stabilize the blood glucose during the night? Or D, increase the dosage of basal insulin to prevent early morning hyperglycemia? Tell me what you got in the comments, y'all. All right, so stem of the question states, which of the following changes in treatment is most likely to improve their condition? All right, so we're still talking treatment, but we're going to need to make some changes, right? So it's saying here that after reviewing the treatment plan, we suspect that the patient may be experiencing this Somogyi effect. So they've been having this hypoglycemia in the middle of the night with the high um, blood glucose levels in the morning, right? So definitely sounding like the Somogyi effect, right? So the best thing that you're going to want to do is C, provide a bedtime snack to help stabilize that blood glucose during the night, because again, that nocturnal hypoglycemia and your body having that rebound effect is what is causing the morning hyperglycemia. Do not do the things to just treat the morning hyperglycemia. Remember, we have to treat the source, treat the cause. The cause is the hypoglycemia at night. So C, give them a bedtime snack to help stabilize it, okay? All right, you guys. As you can see, we went the knowledge style question for Somogyi and Don, the diagnosis of Somogyi and Don, so that you're able to identify those. And so then I wanted to go through some treatments. So we'll continue to work through the endocrine system. But if y'all have questions, please let me know so that I can go over those with y'all. But as always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I do offer is linked in the bio of this channel, including the website. And as always, if you're looking to book any of my one-on-one sessions or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure that you're booking the appropriate session type. Okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.